Occupational Safety and Health Administration. And we're very pleased today to welcome David Michaels, who's head of the agency. OSHA is an unusual agency, I think, in that it probably receives more antagonism and complaints from big business than any other agency. At the same time, but it's probably at least proportionate to what it's, maybe proportionate to its budget. And is maybe the least appreciated for the important work it does, I think, because of quite intense class bias in the media and in Washington policy circles. So it is it's had a tough history doing vitally important work. And I'm slightly worried that it may be about to be tougher, although hopefully going to hear why my concerns are misplaced. The Obama administration today has issued a new set of an executive order and some clarifying material on regulation, which raises anew the need for agencies to make sure they consider costs of regulation along with benefits. The President published an op-ed in the Wall Street Journal today signaling some concern for business arguments about how regulation undermines job creation and job preservation, which we think is very misplaced. And we know in the context of this broad discussion about regulation that OSHA has been one of the agencies that the Chamber of Commerce and their friends are complaining about the most. All that is context. We are very pleased to have as the head of this vitally important agency, David Michaels. We're going to hear a bit more about him in a second from Sid Wolf, who runs our health research group. But suffice it to say that it's great to welcome him here as a champion of workplace safety. He comes from George Washington University, where among other things he wrote a book, Data is Their Product, How Industry's Assault on Science Threatens Your Health. And prior to that was worked in the Clinton administration, worked on workplace safety in the Department of Energy. So it's an unusual thing, strangely, to have a champion of workplace safety at the head of the Workplace Safety Agency, and we're very pleased that we do right now. And three more words. Dr. Wolf.
David and I have known each other for a fair amount of time, but we share one very important hero, Tony Mazzocchi. Tony Mazzocchi, as David knows, was on our board of directors until he died now 8 years ago, believe it or not. And he really was a rabbi in a way for me in terms of getting me involved in occupational health even before we started Public Citizen. Just a brief story to contrast the first Secretary of Occupation, Assistant Secretary of Labor for Occupational Health with the one you're seeing now. This was a few months before Public Citizen was started. I was at NIH and I got a call from Tony Mazzocchi one day saying, we have a worker that's been hospitalized with acute mercury poisoning, which is an almost unheard of disease in West Virginia. Could you come down and see him in the hospital and see if there's any evidence that other workers there are also suffering from mercury poisoning? And so I took leave from the Public Health Service because although I thought this was Public Health Service, I didn't want to get anyone in trouble. And I went down there and did a symptom survey, and there were a number of workers there who had early symptoms of mercury poisoning, and I saw the guy in the hospital. I'd never seen a case of acute mercury poisoning. People said then and now that the last time someone saw that was the Mad Hatter in Alice in Wonderland, which was also mercury poisoning. Anyway, just to make a long story much shorter, we found that there was a problem, and we asked OSHA to do an imminent danger inspection. The law had just gone into effect a couple months before that, and they had never done anything like that. And we got an appointment to meet with the Assistant Secretary of Labor for Occupational Safety and Health, George Gunther. George Gunther was a textile executive, and he was picked for that reason, I believe, by the Nixon administration to be the head of OSHA. And Tony Mazzocchi and I and Steve Watka walked into his office, and his feet were up on the desk, and he was smoking this huge cigar. And we said, you know, these are the findings of mercury poisoning there, and we would like OSHA to, on an emergency basis, go there and do an imminent hazard inspection. And he said, and I will never forget this, he said, I wish the first request for an imminent imminent danger inspection under the new law had been an exploding boiler instead of mercury poisoning, signaling the fact that they were really not interested and capable of wanting to do things on chronic health hazards. The work that we've done here, as David knows, has been almost exclusively on the health side. And we've been involved, I think, a total of 19 petitions we filed with OSHA. Most of them only after litigation did we get what we wanted. They included the first OSHA regulation, which we had to litigate to get worker hazard notifications back 20 years ago, 30 years ago. And then other chemicals such as ethylene oxide and cadmium and hexavalent chromium. Two that are pending now, so to speak, are beryllium and the resident work hours for medical residents. And we hope some kind of action will happen on those. But just the contrast between this Nixon-appointed cigar-smoking textile executive sitting there and really dissing the idea that health was something that should be of their concern, and David and his history, the book he's written, and the concerns he has couldn't be sharper. So I'm proud to know you and to have you come and talk with us.
Well, thank you so much. Thank you. It's lovely to be here. Thank you for both of you for mentioning my book. The book is potentially controversial. I say a lot of very strong things about the science used to attack regulation, and since it's come out, there has not been a single instance where someone has said I got a single fact wrong. And the only reason I say that is because the woman who checked the facts and was responsible for the more than 1,100 footnotes or endnotes in that book is here, Chrissy Morgan. So I'm very grateful for her help putting it together. I stand before you today the day after the nation celebrated Martin Luther King Jr.'s birthday. Dr. King lived and died to ensure that all women and men in this country were able to realize the right to freedom and equal opportunity. Dr. King was gunned down almost 43 years ago, leading a strike of garbage collectors in Memphis, Tennessee. The strike was sparked by the death of two of their co-workers, Ethel Cole and Robert Walker, who were crushed to death in a trash compactor. But it wasn't until 3 years after the death of Dr. King that workers in this country were granted another basic right, the right to a safe workplace. The Occupational Safety and Health Act was signed by President Richard Nixon on December 30th, 1970, and OSHA was born on April 28th, 1971. Before that date, although some states had decent worker protection laws, most workers in this country had no right to demand a safe workplace. Instead, they were told they always had a choice. They could continue to work under dangerous conditions, risking their lives, or they could move on to another job. When the worker was killed on the job, maybe there was an investigation, maybe there wasn't. When the worker died of an occupational disease, often many years after exposure, it was just one of those unfortunate things the workers and their families had to live and die with. And it wasn't until 10 years later that workers in this country gained the right to know what chemicals they were working with, the hazards of those chemicals, and how to protect themselves. 4 decades after the signing of the Act, OSHA is making a difference in the lives of millions of workers. Worker deaths in America are down from perhaps 14,000 in 1970 to 4,400 in 2009, in a workforce that's doubled in size. Injuries and illnesses are down as well, from 10.9 incidents per 100 workers reported in 1972 to less than 4 per 100 last year. Some of this decline was due to the shift in our economy from manufacturing to service industries, but clearly much of the progress is due to tougher government standards and greater awareness of workplace safety practices brought about by OSHA. In the late 1980s, for example, OSHA enacted a standard to protect workers in grain handling facilities from combustible dust explosions. Since then, grain explosions have declined 42%, worker injuries dropped 60%, and deaths 70%. OSHA's 1978 cotton dust standard drove down rates of brown lung disease among textile workers from 12% to 1%. I see Charlotte Brody in the audience here who worked very hard on that issue in the 1970s. I'm grateful for your work on that. Since we began, worker exposure to asbestos, lead, and benzene have been dramatically reduced. And in the last decade, new standards have helped shield healthcare workers from needle-stick hazards and bloodborne pathogens. The clear impact of OSHA can be seen on a daily basis. Last week in Secaucus, New Jersey, a 25-year-old worker doing repairs high up on an outside wall of a residential tower fell, but he was saved from striking the ground by the safety harness he was wearing. He was shaken up and bruised, but he's alive. Many lives have been saved. Many more people live to see and enjoy their retirement because workplace safety and health standards have been instituted in America. Still, while worker deaths, injuries, and illnesses are far lower today than 40 years ago, they're not low enough. There's still much, much work to be done. This country's conscience was recently rocked with the death of 11 workers on the Deepwater Horizon oil platform, and several years before that by the death of 12 workers at the Sago coal mine in West Virginia. Yet 12 workers are killed on the job every single day in this country. If a Deepwater Horizon or Sago-like disaster was reported in the news every day, it would be a public outcry. But because these 4,400 deaths a year usually happen one at a time, alone, in towns large and small across the country, they rarely make headlines. Even less noted are the more than 4 million who suffer a serious job-related injury and tens of thousands more who suffer serious job-related illnesses every year. And what's most important, most of these deaths and injuries are entirely preventable by basic safety precautions, such as providing a safety harness and line to prevent workers from falling off a roof, shoring up a trench to make sure it doesn't collapse, guarding a machine so the worker doesn't get his hand cut off. Meanwhile, 40 years after private sector workers in this country were given the right to a safe workplace, over 8 million public employees in this country still do not enjoy that basic human right. In half the states of this country, you're not breaking any law to send a worker down into an unprotected 20-foot deep trench without shoring or up on a roof without fall protection, if that worker works for the state or municipality. OSHA is a small agency. Federal OSHA has only about 1,200 inspectors to cover 29 states. OSHA-funded state plans have around the same. So there are less than 2,500 inspectors to cover 7.5 million workplaces, employing more than 130 million workers. What this means is that OSHA must carefully target its efforts and leverage its resources. One way we do this is through targeted inspections and penalties, but even there we're hobbled. The maximum fine for a serious violation is $7,000, a small fraction of those imposed by other federal agencies. By comparison, the top penalty for violating the South Pacific Tuna Act is $350,000. Similarly, the maximum criminal penalty for a worker death associated with a willful violation of an OSHA standard is a misdemeanor, maximum 6 months in jail. Yet harassing a wild burro on federal land is a felony with sentence of up to a year in jail. In 2001, at a Delaware oil refinery, a tank of sulfuric acid exploded, killing a worker named Jeff Davis. His body literally dissolved in acid. The OSHA penalty was only $175,000. Yet in that same incident, the death of thousands of fish and crabs led to an EPA Clean Water Act citation of $10 million. How can we tell Jeff Davis's wife and his 5 children that the penalty for killing fish and crabs is many times higher than the penalty for killing their husband and father? We have other challenges as well. Our vitally important whistleblower program is hobbled by a weak law and lack of resources. And I'm not betraying any secrets to note that despite the progress we've made, despite these problems, progress we've made dealing with these problems, this small agency is under attack. In fact, the agency has been under attack since the day it was born. The attacks on OSHA are part of attacks on the role of government as a whole. OSHA enforcement, our critics claim, are counterproductive because they're confrontational rather than cooperative. Punishing after a fatality is not prevention, they say. OSHA regulations slow the growth of business and are especially hard on small businesses. So I'd like to say this as clearly as I can. OSHA is not working to kill jobs. We're here to stop jobs from killing workers. We're here to ensure that workers have the tools to keep themselves from getting sick and dying in the workplace, and that employers have the information they need to make sure workplaces are safe. This administration believes that violations that result in significant penalties present a deterrence, to employers who would cut corners on safety. Because our low penalties are set by law, and the last time they were raised in 1990, we have to be creative in how they're applied. So in the last 2 years, under the current administration, OSHA is attempting to increase deterrence with 3 strategies. We're introducing a new targeting program for recalcitrant employers, strengthening our penalty structure, and using all the powers of publicity at hand to expose bad actors in the public arena. Last year, we added over 100 new inspectors and whistleblower experts and launched the new Severe Violators Enforcement Program, or SVEP. The program targets enforcement to recalcitrant violators who endanger workers by demonstrating indifference to their responsibilities under the law. Currently, about 89 employers in SVEP, which means they receive special attention from OSHA. Last year, we also issued a new penalties policy that will result in increased employer fines while maintaining OSHA's policy reducing penalties for small employers and those acting in good faith. While our maximum penalties are still set by law at very low levels, we can control how and when we allow reductions to these penalties. The changes will reduce the level of reductions to send a stronger message to employers with serious violations that cutting corners on worker safety and health is unacceptable. Finally, OSHA is using the public spotlight to expose the worst violators. We're using our press releases to name employers who have broken the law, expose their failings, and detail hazards uncovered by our inspections. An employer's fear of being publicly identified as a violator of OSHA regulations is a powerful incentive to abate hazards. But our belief in the value of enforcement does not take away from our recognition for the need for cooperative programs and compliance assistance. In fact, we've sought to increase funding for our small business on-site consultation program, which provides free assistance to small businesses who can't afford to hire a full-time safety person or consultant. Last year, close to 30,000 small businesses took advantage of this free on-site service. As a result, no small businesses in this country should fail to protect its workers simply because it can't afford good safety information or can't understand how to employ safety and health standards. We're also focusing on compliance assistance to workers who do not have ready access to health and safety information. The creators of the Act provide workers a number of rights: the right to request an inspection, the right to receive information, the right to be protected from retaliation. But the creators of this legislation also understood that the right to a safe workplace would never be fully realized unless workers have the knowledge, tools, and security to participate in the process. The most vulnerable group of workers in America today are immigrant workers, and especially immigrant Latino workers. They work in the most dangerous jobs and suffer injuries and deaths at greater levels than their peers. About 12 Latino workers every week, all year long, are killed on the job. Most of these are in construction, but many are injured in the housekeeping industry and in manufacturing. To find ways to reach out to these vulnerable workers, last summer in Houston, we convened the first National Action Summit for Latino Worker Health and Safety. This 2-day summit brought together more than 1,000 participants, including workers and representatives from employer associations, labor unions, the faith community organizations, medical, safety health professionals, educators, government officials, consulates, other non-traditional partners. Many ideas came out of this Houston summit. We're following up in every region of the country to implement new partnerships, alliances with neighborhood groups, with the faith-based community, other nonprofit organizations. A recent example of successful collaboration is the Laboral Call Center in New York. This was arranged through a partnership between Mexico and the Department of Labor's Wage and Hour Division, and with OSHA, and with the cooperation of the local Catholic Migration Office. Area Latino workers who call a toll-free number receive education and guidance about their rights in the workplace, and they can place a confidential complaint. We know that when workers are informed and empowered, they're inoculated against rogue employers who seek to exploit them. Now, the Act also obligates OSHA to set standards that will protect workers. Far from impeding business growth in this nation, these standards and the enforcement of these standards sets a level playing field for all businesses in the country so that those employers that are investing in safety are not underbid by unscrupulous ones who cut corners. Looking at the last 40 years, it's clear the agency has had a significant impact on reducing injuries from safety hazards, like trenching and falls, and certain health hazards, such as exposure to cotton dust and asbestos. When addressing workplace exposure to chemical hazards, however, our impact has been more limited. This presents a public health issue that we're committed to addressing in this administration. The vast majority of OSHA chemical standards were adopted in the first years of OSHA's operation based on the science of the 1950s and 1960s, and sometimes earlier. Science has moved on. Today we know that significant danger exists at lower exposure levels than were thought almost half a century ago. OSHA's chemical standards need to be updated, but the agency faces significant challenges. The process for setting standards, set down in the OSHA Act with provisions for stakeholder input, is intentionally complex and slow in order to allow all potentially affected parties to have a voice in the proceedings. This resource-intensive process also means that OSHA can only establish a few standards at a time. Encumbered by this rulemaking process, we're left to play whack-a-mole while workers are getting sick and dying. So OSHA is exploring other approaches to address the hazard of numerous toxins in the workplace that can kill or sicken workers. We've been talking to stakeholders, and they're now reviewing and considering a number of approaches that could be more efficient than the traditional, laborious, lengthy rulemaking process to save workers' lives. When I speak about workers' lives, implied in this discussion is the impact of workplace injuries and illnesses on families. When a worker is sickened, injured, or killed on the job, the impact on that person's household is both emotional and financial. The death or disability of a breadwinner robs children of the love and care of a parent. It can plunge a family into crushing debt, dash hopes for sending children to college, and trigger waves of other social and economic problems. This is not the promise of the American dream. For most of the 20th century, workplace safety and health reform has been reactionary, the result of a tragedy such as the wave of reforms following the death of 146 garment workers at the Triangle Factory fire in New York 100 years ago, this March 25th. And we are now a decade into a new century, and OSHA's focus must be to prevent tragedies before they happen. The government can't be the only watchdog for workers. There simply aren't enough inspectors to cover the whole country, all workplaces. The burden of workplace safety and health must lie with employers. Last year, we announced that OSHA is working toward proposing a rule that would require employers to implement an injury and illness prevention program. This effort is part of the Department of Labor's new initiative, Plan, Prevent, Protect. It presents the most fundamental change in workplace culture since the passage of the OSHA Act. With this change, employers would be required to take an active approach to ensuring safe and healthful conditions for their workers. There will be no more waiting for a worker to get sick, hurt, or killed to address a problem. No waiting for OSHA to show up to do an inspection. No playing a deadly game of catch me if you can with the government while risking the lives of workers. This plan would make it mandatory for employers to develop a plan to find and fix their workplace hazards. And not just the hazards covered by OSHA standards, but all recognized hazards. Since announcing this regulatory effort almost a year ago, we've held a series of stakeholder meetings and conducted critical research. We're poised to begin a small business review this summer, and we're committed to persuading business owners that this plan is in their best interest. Injury and illness prevention programs are not new. This approach has been embraced by thousands of employers across the country, and similar to standards currently in place in California, Washington, Minnesota, and other locations as well. As we pursue this plan, OSHA will welcome the support of public citizens and other stakeholders. Now finally, I want to tell you again what a privilege and pleasure it is for me to be here today. This is the first of a number of speeches I'll be making for OSHA's 40th anniversary, and it's altogether fitting and proper that this maiden speech take place here. Public Citizen and its related and predecessor organizations were active in advocating for passage of the OSHA Act in 1970, and we are grateful you remain one of the nation's leading advocates for worker safety and health. In fact, before coming here, I pulled out my copy showing those. Bigger Wages, which is a fabulous introduction to the OSHA Act and what led up to it. And I recommend it to everybody who needs to know why the OSHA Act is the way it is. Obviously, it was the result of compromise and political struggle in the 1970s. And it was written by Ralph Nader's study group report on disease and injury on the job. That's what's subtitled, written by the Center for Study of Responsive Law, and talks about the work of Public Citizen's predecessors in getting the OSHA Act passed. Over the years, Public Citizen has prodded, pushed, occasionally taken legal action to move OSHA in the right direction, advocating stronger worker protections from carcinogens, lead, cadmium, beryllium, hexavalent, chromium in the workplace, as Sid mentioned, and petitioning to reduce work hours for truck drivers and medical residents. For your advocacy on behalf of working men and women and courageously demanding the best from government, OSHA is grateful to public citizens. 40 years since passage of the OSHA Act, we can look back with pride at the progress we've achieved, and we can feel hope and confidence meeting the challenges that lie ahead. And we know this road is not an easy one. In every direction, we face difficult challenges, but I'm optimistic. Tony Mazzocchi, Sid mentioned, our great leader and mentor, pioneer in health and safety in this country, spoke to his friends shortly before he died of cancer. He told us, "I am both afflicted with an incurable disease and blessed with an incurable optimism." I believe that if we work together to educate workers about the hazards they face and the rights they enjoy, if we work together to make sure they're able to exercise those rights, if we strive to educate politicians and journalists in this country about the need to protect workers, if we work together with responsible employers in this country to develop the management programs and technologies that can overcome workplace hazards, together, moving forward into this century, we can move closer to realizing the promise that was given to American workers 40 years ago. The simple yet basic right to go to work in the morning and come home safe and healthy to your family at the end of the day. Thank you very much.
Thanks very much, David. So David's generously given us a fair amount of time, so we all a fair amount of time for some conversation. Let me just start and ask you a couple questions. Sid just forwarded me earlier a testimony that you gave in the House or the Senate in 2007, I think, with the question, is OSHA doing what it's supposed to be doing for workers? And you answered the capital N-O. How's OSHA doing today in the grand sense? And if not all it should be doing, what are the top
What's really
priorities?
interesting, all the new priorities aren't a surprise, because actually I testify about them, and actually the last chapter of my book talks about them. I said, this is what we need to be doing, and then I was asked to head OSHA to take it in that direction. OSHA, I think, does an excellent job with its resources, getting out to factories, issuing citations when appropriate, and trying to leverage those resources to have a better impact. But we have limited tools. So what we're trying to do is focus on a couple of new initiatives that will really strengthen our ability to deter, to prevent injuries and illnesses from occurring. And I think the biggest one is injury and illness prevention programs. And we have to essentially make it clear to employers that they need to think about what their hazards are and address them. And many employers do this. I mean, this is no surprise. I go to meetings all the time with employers, employer groups say, of course we do this. But a lot don't, and that's where people are particularly getting hurt and killed. But the standardizing process is slow, so I think it will take a long time before we get there. But that's a very big initiative that I think will make a big difference. The standard setting process is broken. We can't fix it ourselves because it follows certain laws, but we can do what we can within that process, and that's what we're trying to do. So.
Let me ask one more thing, and Sid will jump in and we'll open it for everybody else. You mentioned the sort of limitation on your prosecutorial authority, especially in the criminal area. What do you see as the opportunities for working with local and state prosecutors under traditional criminal law?
It's something we ought to be looking at much more often, and we're certainly talking about that. We've had a number of cases recently where, I'm not an attorney, but I look at this and think this is what happened here was criminal. Now, whether or not we can find a prosecutor to take that case on, we'll see, but we certainly are talking about that and trying to reach out to local prosecutors. It's very difficult to get a federal prosecutor to take on a case if at best the prosecution will lead to a misdemeanor. And so we have to think about other approaches to that. And local law is probably maybe more effective.
A couple of things, just on the note you were just talking about. I think probably 28, 30 years ago in Detroit, a worker was killed because of really negligent exposure to cyanide. And the local criminal authorities prosecuted successfully for manslaughter. Now, I'm sure that that's not the last time something like that happened, so I think I echo what Rob was saying. I think that there's enormous opportunity without the limitations of what's built into the Occupational Safety and Health Act to do that. I mean, when you may be called in after the fact to see what happened and so forth, but there's probably not that much limitation on your sharing this information and whatever you find. The other related question, which also comes from this testimony you gave almost 4 years ago, you decried in that testimony the lack of adequate application of the general duties clause. I mean, without getting into the legalese, since I'm a doctor, not a lawyer. Standards are time-consuming. The ones that we've succeeded or helped to succeed in getting taken care of were after litigation. But even if there isn't an explicit standard on a given workplace exposure, such as resident work hours, OSHA does have the authority to go in there under what is called the general duties clause and look at what's going on and still potentially cite the company for negligence. You want to just talk a little bit about, because it's now almost 4 years since then, an example or so of OSHA using the general duties clause in ways that you've properly decried and not been really adequately used before?
Absolutely, and we're now, I mean, we're trying to use the general duty clause much more. I mean, the OSHA Act has two provisions around saying what a safe workplace is. The first is standard setting ability. We set standards and regulations around specific chemicals, hazards, etc. But it also says, just in general, employers have the obligation to provide a workplace free of recognized serious hazard. And when there is no clear standard that needs to be that is applicable, we look at this question and we say, is this a recognized serious hazard? And we think yes. And the example this year, which got the biggest press in some ways, was and also illustrates how it's reasonable to use it, is the SeaWorld example. We have no standard for killer whales, but we've known since Pliny the Elder that these whales we call killer whales are
Killer
dangerous.
politicians.
We have no standards on those either. But so we issued a series of citations associated with the death of a trainer at SeaWorld using the general duty clause. We're looking at different, and we use it in various other places. We're trying to use it more and work out a system. It's a much higher bar for us. We have to be able to, we have to show that it's a recognized serious hazard, but we believe we can do that. And part of the one of the other approaches we're taking is when we see a hazard, we're out notifying employers of that hazard so they have knowledge of it, because knowledge of it is a component of it. So, for example, there have been a series of terrible grain entrapments where workers go into grain storage facilities, grain bins, silos, different sizes and different names, and they go in without any protection. There's often no one monitoring them. They're not in a harness, and they go in to essentially knock the cake grain off the sides or break up grain cake, and they're engulfed and they're suffocated. And this has been an issue that Purdue University has been following for a long time, and there were more grain entrapments last year than there has been in the last several decades since Purdue started following it. Partially, we think because the quality, it was a very wet year, so the grain was not as good quality. There were all sorts of technical reasons, but there were a number of fatalities, including 2 young people, one a 14-year-old in Illinois. So we were just appalled by this. This is we've known for many, many years. In fact, the Phoenicians or the Egyptians wrote about how you shouldn't enter grain storage facilities because of the gases that come off. And this is, yet people are still being sent in with no protection. So we sent letters to grain handlers, grain handling companies across the country, informing them of the hazard, so it's very clear they have knowledge of the hazard. So if there's a problem, if there's an entrapment, we can show they were informed, and that can lead to all sorts of, much more ability for us to pursue them if there's an entrapment. Obviously, the reason we do that, though, is not because we want to catch them. But the reason we send these letters out, though, is we'd like these problems to be prevented before we get there and before someone is hurt. But it's a little off your question, but that's where we're going with some of this.
Okay, any questions?
And tell us who you are, Laura.
Stephen Leon from DNA.
Yeah.
Can you comment on how the White House executive order is going to affect OSHA's ability to move forward on rulemakings?
I just reviewed briefly the executive order for those of you who don't know the executive order came out today. OSHA has always issued, I think, what are common sense standards that take into account the needs of the various stakeholders. And we have a process that addresses them, and this will continue that. OSHA standards, there have been numerous studies that look at OSHA standards, and the accusations that these standards cost tremendous amount or kill jobs. And in fact, All the studies have shown that that's not the case. There was a study done by the Office of Technology Assessment a few years ago, a number of years ago. They looked at, I think, 6 or 8 OSHA standards, and they showed very clearly they cost less than expected, and they pushed innovation, and they were very effective, and they didn't kill jobs. So we're quite comfortable that the requirements of this standard will be, the requirements of the new executive order are ones that OSHA can live with. I was very pleased. There are a number of things in there, though, that we think will be helpful to us, the sort of things that we've been talking about. Scientific integrity is one, for example. It's my understanding this is the first executive order that says that agencies should ensure the integrity of the scientific organization on which their standards are based. And